Hello, everyone, and welcome to Code Red by Women for Women. I'm your host, Sophia Allen Hendricks. The topic of a woman's menstrual flow and the challenges experienced is still a taboo subject. Furthermore, the issue of safe menstrual products is not often discussed. Here on Code Red by Women for Women, we help shed light on this particular subject. We talk with women on the front line of the Justice for My Jewel awareness campaign and the women they have helped through their awareness. We also talk with advocates and specialists in the areas of women's well health. So on this Sunday, my very special guest is Dr. Tyrone Malloy. Dr. Malloy, welcome to the program.
Well, thank you for having me. I
I
appreciate it.
appreciate you being here. Thank you. I know you're hugely busy, so I know this is especially special for us to have you stop by. So, for those who obviously don't know you, I'd like to share a few excerpts from your bio. Just to give them a flavor of who you are. You received your MD from Johns Hopkins University School of Medicine. You did your residency in obstetrics and gynecology at Walter Reed's Army Medical Center. You actually went and got a JD from Georgia State College of Law as well. You have been a clinical research assistant rather with the Department of Pediatrics and Endocrinology. You are an adjunct clinical professor at Emory University. You're also a medical consultant with Jewel Premium Sanitary Napkin. Have I missed anything, or is there anything else that you'd want us to cover today?
Well, important part, and matter of fact, is how I got involved with Jewel. Is I also was the founder and director of the Soapstone Center for Clinical Research, which is a research center indicator that primarily is involved itself with women's health. And we've been doing research there now for the past 16 years, and we've done well over 100 studies just on women's health.
Wonderful, wonderful. That's amazing to hear. So thank you. We want to make sure that folks really understand your background and why we're talking with you on our program. So I want to start with having been a practicing gynecologist. What are some of the most common issues that you've treated patients for associated with their menstrual flow?
Well, most of the time it's because the flow is heavy, or obviously there's some instances where it's irregular. And when it's heavy, usually in the African American community, we have to be thinking of fibroid tumors. And as a lot of people heard fibroids or uterine myoma, which are the same, it's something that really concerns women because the first thing that they're told when given that diagnosis is that, you know what, you may have to have a hysterectomy.
Wow.
Whether they're in their late 20s, early 30s, it doesn't matter because you can develop uterine fibroids in your 20s. No woman wants to hear that her outcome may be infertility because of a tumor. And so my interest also, which led me to do a lot of research, was because of that. But fibroids, bleeding, infertility, pelvic pain. And you have patients who go doctor hopping because no one can seem to find out the cause of their pain. So those are the things that we see a lot in our practice.
Absolutely. Thank you. And you mentioned, getting a hysterectomy. What are is that one of the more common treatments? Are there other treatments that, is typical to be offered to women who are experiencing the challenges you just mentioned?
Oh, definitely. I mean, you can something as simple as just removing the fibroids and retaining the uterus. We call that a myomectomy. That's if you needed to actually do major surgery. Another instance is something called we call uterine fibroid embolization, whereas they actually block the blood vessels that are going to the fibroids. If you stop the blood from going to the fibroids, you're decreasing the oxygen. Okay, those fibroids will die. In that case, there's no surgery involved. Patients can usually go home the same day and preserves their ability to maintain their fertility. So those are the two common, unless something as simple as a DNC, maybe that can shave down a fibroid. But the two major things to stop the bleeding would be a myomectomy and a uterine fibroid embolization.
Got it. And from your experience in your practice as well as a researcher, how many, sort of what are some of the numbers in terms of the women that experience the heavy flow that we talk about? And a lot of women who've been on our program talk about that as a very personal challenge they have. How many women would you say, just ballpark, in terms of having this particular challenge that we deal, just so that people watching could understand sort of how significant this is?
Well, during a woman's menstrual life, I would say 50 to 75% of women are going to experience heavy flows at some time. And that's another issue. A lot of times it may not be uterine fibroids. It just may be what we call dysfunctional uterine bleeding. But there's a tendency to want to label women with fibroids because they're thinking, the average physician might think, well, she's an African American, she has heavy bleeding, her mother had fibroids, she may have told the doctor, my mother had a hysterectomy. So sometimes they'll think that direction
Wow.
without thinking of some other possible causes for the bleeding. Just because you have fibroids doesn't mean that that is the cause of your heavy bleeding.
Good point. Good point. And last Thursday was an important day in terms of menstrual health and awareness. And so last Thursday was May 28th, obviously, and it was Menstrual Hygiene Day. And so this was a day where it started in Germany, I believe, and it's really meant to spread awareness and bring awareness on this particular subject, but other parts of this topic. What does that day bring to mind for you as a person in your profession? What's the significance?
Well, to be honest, I really did not know about MHD, as we call it now, Menstrual Hygiene Day, until 2 years ago when Congresswoman Carolyn Maloney in New York was talking about it. Because, like you said, it actually started in Germany. And in America, no one really emphasizes the importance of menstruation. It's part of a woman's life.
Yes.
And so therefore, that day is now recognized as an advocacy day for globally around the world, for people to understand that not everyone has access to menstrual products. Not everyone is able to talk about their menses. It's like taboo. Not many of them, actually, their health is compromised because they could be having a condition that they can't even mention, because when they say menses or period or bleeding, they're so afraid that someone's going to look down upon them that they will hide something else that may be
Right.
going on. They could be having uterine cancer, but they're thinking it's my cycle or it's bleeding. No one wants to hear about it, and so they will sometimes keep those symptoms to themselves, which is not really a symptom, it's a part of their physiology of their life. And so this global awareness is to say, hey, we can talk about the menses. We should not be afraid of it. And everyone should be aware of what women go through. Every day, 300 million women are having a cycle.
Thank you. We seem to be having a little technical difficulty there with some of your statements, but essentially what I heard you say is really May 28th Day is really intended to help lift some of the taboo, if not all of the taboo, associated with something that is very natural for a
That is
woman
correct.
to experience, and for girls of a certain age range, light and bring awareness to this subject, and in some respects normalize it, because to your point, there are still places in the world where women can't talk about this subject, or girls. My understanding, just from my own research, is they don't even have the means to deal with this particular thing in private, and really be able to go about normal day-to-day things that some individuals do take for granted. So I appreciate your point of view on that, and sort of talking about how that even came stateside through these individuals, and how they're trying to raise our consciousness and awareness about the subjects. So I really appreciate that. So
One small point
sure.
for people to remember the day. It's May 28th because May is the fifth month. the average woman bleeds for 5 days, okay, and her cycle's 28 days. So that's how they came up with using May 28th as a day to help people to remember that it's Menstrual Hygiene Day.
Absolutely. That's a great point. A great point. Thank you. Now that also takes me down another thought that I want to get your point on. As a medical consultant for Jewel, as a researcher, as a someone who's practicing gynecologist, because I believe you still do see patients. What makes Jewel premium sanitary napkins different? And I ask that because on this program, we talk a lot about the awareness through the Justice for My Jewel campaign, but we also talk about the product through the women's experiences that have been on the program. But for you, what makes this product, Jewel, different or unique to others that's out there on the market?
Well, there are two ways I like to look at the Jewel napkin, from the standpoint of the environment and from the standpoint of the benefit to the woman who's using it. First of all, it's all natural. And it's amazing what the plastic has now done to pollution, what
Yes.
plastic has done to our sewer systems. And so the average product that's out there on the market has these ingredients, has these materials that actually are polluting the environment. So that's one aspect. And we got to think about the environment going forward. From the standpoint of health, a lot of women look upon that cycle. They almost dread those days because of the amount of bleeding, the fact that they have the pain, the fact that it's coming. And so now we have a product that definitely changes their perspective on how they look at their cycle. I know some people have been using it and don't understand necessarily why they've seen these benefits, where the cycles are less, the cramping is less, the woman just feels better. And what we have in the pad it's called graphene. Actually, it's graphene oxide. So if anybody wants to actually learn more about this particular, we call it now the wonder material, is to look up the medical benefits of graphene. Because if you just look up graphene, it's being used for everything. I mean, literally everything.
That is
But,
true.
but as far as the medical applications, what graphene does is it actually lets off energy. That energy goes into the body. And when it goes into the body, it actually helps to dilate the blood vessels. It's the microcirculation. And when it dilates the blood vessels, what does that do? It provides more oxygen to the tissues. And we all know that oxygen is needed to basically provide the benefits and the well-being of a tissue. And so therefore, if you can increase oxygen to a tissue, what are you doing? You're helping it to heal a lot faster. And so when people have a cycle, really the reason they bleed the number of days that they're bleeding is that the lining is trying to heal. Since the person did not become pregnant, they've sloughed off the lining. Now it has to heal. And the amount of days it takes to heal determines how many days they bleed. Well, now if you're adding an ingredient that can help speed up that process,
Yeah.
this cycle will be less, the cramping will be less. Another factor that makes the cramping less is that it also decreases the production of something called prostaglandin. Prostaglandin, you don't have to even worry about that big word. Is just something that we all women make prostaglandin, whether they're in labor, whether it's their cycle, whether they're having a miscarriage, they make prostaglandin. It's the prostaglandins that cause the contractions and the cramping. So if you can decrease the prostaglandin production, you'll have less cramping. That is another element of graphene. It definitely helps to decrease the production of prostaglandins. And this is kind of why your NSAIDs, your Motrin, Aleve, Advil, that's why they work so
Right.
well, because they block the production of prostaglandin. So graphene actually energizes, that's about the best way to describe it. It energizes the actual circulation in the uterus, the vaginal walls. It also, because it has a natural I like to call it anti bacterial, antifungal effect, that the when your blood is coming from the cycle and is carrying bacteria, graphene will help to lyse, okay, the cell walls of the bacteria. So that's why women will say that they notice that they're not
Mm,
having the odors, they're not having the vaginal itching, they're not
right.
having the irritation. So there's a lot more to our pad, okay, than just the fact that it's collecting the menses. It also has a therapeutic aspect to it. And that's why these testimonials that you're hearing from around the world about the jewel napkin is those, that's the science
You cut
behind
out
it.
a little bit, Dr. Malloy.
I'm sorry. Can you hear me now?
Can you hear me? You cut out a little
I,
bit.
I can. Okay. What I was saying was the reason why you're hearing the testimonials that patients are talking about how they're noticing these changes is that the graphene actually has the ability to do these things. In addition, another aspect of graphene, it helps absorption. So a dual sanitary napkin can hold almost 4 to 5 times as much menstrual blood as the ordinary napkins that are on the market right now. So the woman is getting a better napkin, more eco-friendly, and it has a therapeutic benefit that has science behind it.
I think my sound went.
I can
I'll
hear
try to
you.
get back in just a moment. Sorry, folks, just a little technical difficulty. I think my sound has gone out. My apologies. Bear with us just a second. Can you hear me again, Dr. Malloy?
Oh yeah, I never lost you.
Perfect.
Okay.
I'm not sure what happened. Thank you so very much. I was hearing you talk up to the point where we were talking just about, and I'm sure for those watching, I just want to make sure that they got the full scope of your thoughts. Sorry about that. In terms of just talking about the actual inner workings of the graphene and sort of all the properties and benefits that it affords women, and what's in our product. And just to be able to sort of hear the medical explanation, if you will, of how the oxygen and all the various things that the graphene allows for the body to do, I think is phenomenal. The fact that you were able to share with us that the healing properties and the fact that the actual inner lining and that process that allows the body to heal faster and thus makes the period itself a lot shorter, I think is very interesting, and I haven't heard it represented that way. In terms of the jewel pad and the strip that's inside it, the graphene that we've been talking about. What else is there for women or anybody watching who has been thinking about or listening to us over the many weeks that we've been on? Is there anything else that you'd want them to understand and really recognize as it relates to graphene and the medical application and how the position that Jewel has taken to make sure that this particular technology is in our paths? Anything else that you'd want them to sort of be thinking about and leave them with if they take nothing else away from this conversation?
Well, I'm glad you asked me that. I think we really need to, for everyone needs to understand about graphene. When the CEO of the company, Damon Crump, and several of us went to Washington to introduce the United States, okay, to graphene, it was amazing how many people know nothing about graphene. So probably the listeners are probably saying graphene. I've never even heard that word before. And it's nothing more than graphite. Okay, it's graphite down to the carbon atoms. But
Right.
we use right now during COVID-19. And by the way, I don't usually have my mask on in the house, but I have it on to let people know be safe. But what
Yes.
I want to say is we don't realize when we use those thermometers, okay, those are infrared thermometers. Well, that infrared, the way it works is that light goes to the object, the forehead, and the energy, because our bodies make far infrared radiation. It's coming back and is being picked up. Well, the fact that we can take someone's temperature from afar, I just want people to understand what graphene is doing, which is the same thing. It's an energy source. And so when you
Yes.
take the natural body energy source, now you've added graphene to it. Now you can see why that resonance allows the applicable aspects of what we're seeing with respect to healing. Graphene is a wonder material, not just in our pads. Our pads were special. I mean, I'm so
Yes.
happy
Yes.
to be involved with a company that's ahead of the game. Okay.
Absolutely.
But it's, if anyone, when they leave here, just do your own research. Look up the medical applications of graphene. And one more thing I want to say about graphene. Even Bill and Melinda Gates, okay, they have, I won't say donated, they have sent money to the same scientists who won the Nobel Prize for graphene to come up with graphene condoms because, again, because graphene is antibacterial,
Yes.
anti-protozoan, they feel that we can decrease the incidence of infectious diseases, sexually transmitted diseases, by having graphene in the condom. And because graphene is so strong, it'll also make that condom a much better condom. And as far as decreasing the risk of STD. So graphene is something special, and we are fortunate that we have a product that has that. And that's why you get these
Absolutely.
testimonials.
Yes, yes. And I thank you for that because it's, what I'm hearing you say is this is something that's cutting edge. It's leading the way in terms of its application. And there isn't another product or another brand on the market that has this technology. And a fun thing that people will see on in some of the demonstrations or on the website is we actually do a light bulb test
Mhm.
just to demonstrate or illustrate the actual technology that's actually in there. But I love the way you've kind of put it into perspective, put it into the medical application, because if you just see that without the context, you might be still wondering, why is this in a pad? So I love that you sort of took us through the journey of this is what the body's doing naturally, and here is how the graphene is now helping that process along and doing something wonderful for the woman's body. And that also gives context as to why when they hear someone come on and say, my period went from 7 days to 5 days or even shorter, that they now have that context and that better understanding of why that is actually taking place, and not that it's something that, maybe it's a placebo effect or people are just making it up. So I really appreciate you taking us through that journey. Now, I wouldn't end our program without talking about one of our topics that we talk about, which is tampons. And what we generally share with folks on this program is the company does not make a tampon. And I'd love to get your perspective when we think about tampon usage. I know it's very popular among many women for different reasons. So, what's your thoughts and perspective on tampon usage?
Well, the short is, I think it's one of the worst things that a woman can
Wow.
use. Okay. However, it became popular because the pads that are on the market were ineffective. The woman felt like she was wearing, I don't know, a towel between her legs, and she'd rather just have something that seemed to be more convenient. But you're really robbing Peter to pay Paul. The body, every orifice in the body is there for a reason. It has a purpose. There isn't a single orifice in our body that we plug up except the vagina with a tampon. Okay, so that right there must tell you there's something not right with that. The blood flow is supposed to come out. Bacteria, it gets its main substance and nutrients from blood. Every woman has bacteria in the vagina. If you have something that's in the vagina holding the blood, not letting the blood come out, you're then allowing more bacteria to grow on this medium. Well, after a while, the bacteria has to go somewhere. Okay, is this not going to say, I'm just going to sit on this tampon? And so what it does, it looks at the vaginal walls. We know the vaginal walls are very absorptive. And so the bacteria goes through the walls into the bloodstream, and that could be possible causes for pelvic pain, infertility. We don't know for sure. Not only that, if you're blocking the blood from coming out, could some of the blood be going back up through the cervix and maybe increasing the risk of endometriosis? We know that endometriosis is a phenomenon where blood, okay, one of the theories, it extravasates back out through the fallopian tubes and plants in the peritoneal aspects of the abdomen, okay, and then it continues to grow. Well, you are really contributing to that if you are not allowing the blood that's supposed to come out from coming out. And so that's why even on the box, it says, if you look at any box that has tampons, it says using this product increases the risk of toxic shock syndrome. Okay, so a lot of people say, well, I've never even heard of that. So when they see that on the box, they're not even sure what it really
Right.
means. But, let's face it, you can die from that. But let's not even go to the extreme of toxic shock syndrome. There's obviously there is some parameters in between there. So people who may have pelvic pain or just a constant discomfort, not necessarily pain, but discomfort, that could be an aspect before you get to toxic shock syndrome. So let's not always just go to the end. Think about all the conditions that you could be experiencing in your pelvis prior to toxic shock syndrome. So we know the company knows that it has the risk of causing harm. But yet I think they specifically use those terms because 98% of people, when they see those words, are not going to know what the heck they're talking about.
Wow.
And they're going to continue to use the tampons. So the tampon, yes, it was developed because it was convenient, but it has so many health issues. Not only that, but with the tampon, because of the material it's made out of, we don't even know of the ingredients, okay, what's in those tampons, whether or not just some of those ingredients could be going back into the bloodstream or through the vaginal wall. So my thing is, let's face it, a lot of women are going to use tampons, no matter how many doctors, no matter how many nurses, no matter how many health professionals talk about it. I want to say this before ending. If you're going to use them, take them out every opportunity that you can. Don't let the tampon stay in the vagina and let that bacteria cause injury that may be irreversible.
That's a great point. Thank you. I mean, you talk about even the material that it's made out of, and we didn't talk a lot about the material, but you mentioned, for Jewel, that it is all natural, and that's one of the things that for the Justice for My Jewel campaign, as well as some of the other things that we've been talking about, is here to spread awareness to folks, and that's what this show in particular is about. It's about the awareness. It's about knowing what's in the pad that you purchase. It's knowing what the materials are, the ingredients in it, as well as your tampons. And unfortunately, these companies aren't required to tell us what's in them, and so we don't know what's in them. And so, we want to help shed the light on that and bring awareness. And I really appreciate the time that you've spent with us and those watching, really educating us from a medical perspective, and helping us to have a better understanding of our bodies and our periods, and how we can have better health. So I want to thank you, Dr. Madoy, for stopping by, talking with us. We appreciate the nuggets and wisdom that you've spent with us and shared with us today. So for all of you watching, I thank you for stopping by Code Red, by women, for women. I'm your host, Sophia Allen Hendricks. Here on Code Red, we talk with women on their journey to a healthier period. We also talk with advocates like Dr. Malloy, who's promoting awareness and well women's health. You can learn more about the Justice for My Jewel campaign mentioned through jfmj.org. You can also connect with the person who invited you to this live or who shared this video with you. And if you can't, if no one invited you to the show, you can always message us at our Code Red by Women for Women page. Dr. Malloy, it's been a pleasure. I thank you. Thank you so very much. And for those of you watching, my apologies for our technical difficulties today. Hopefully you got the full essence, because for me sitting here, it was a really powerful conversation.
Well, thank you for inviting me.
Absolutely. Thank you, everyone, and have a great rest of your Sunday.
And be safe.
Yes, and be safe. Thank you.